And welcome back to the second episode of the Wellness Paradox podcast. I'm very grateful you've joined us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by this phenomena that I call the wellness paradox. Simply put, the wellness paradox is the gap that exists between what we know as a health sciences community and what we're actually able to address in the real world to make a real difference. This podcast aims to close off those gaps by offering the latest, most engaging, and most evidence-based information in the health sciences. And today in episode 2, I'm very excited that we're joined by Dr. Cedric Bryant from the American Council on Exercise, or ACE. For those of you who have been in the fitness industry, you've likely heard of ACE as a personal training certification organization, but ACE is so much more. As we're going to talk about in this conversation with Dr. Bryant, ACE has a couple of very, very specific initiatives in place to address the physical activity crisis that's going on in our country. If you look at the statistics, it suggested that physical activity amongst the American population, meeting the standard 150 minutes per week set forth by the Surgeon General, is only accomplished by about 25% of our population. And beyond that, physical inactivity accounts for over $117 billion per year in annual healthcare costs. So this is obviously a very, very significant conversation to address the wellness paradox. Anything that I talk about with Dr. Bryant in the episode that you may want to reference or anything that he would like to share can be found on the show notes page for this episode by going to our website, wellnessparadoxpod.com/episode 2. I hope you enjoy this conversation with Dr. Cedric Bryant. Dr. Bryant, thank you so much for joining us today. I really appreciate it.
My pleasure, Michael. Thanks for having me.
Awesome. Well, I want to dive right in because there's a lot of stuff that I want to talk to you about. I've been in the fitness industry for 22 years. My first personal trainer certification back in 1999 was from the American Council on Exercise. So it's kind of funny how this is coming full circle to sit here and talk to you. But lots of questions. But for starters, give me a little bit of an idea of your background, and then maybe extend that into the American Council on Exercise for people who may not know about the organization.
Sure. My career really has been in thirds. The first third was kind of the traditional academic route. Got my Ph.D., taught as a university professor and did research. I taught at Penn State, West Point, and Arizona State. And the middle third of my career, I kind of transitioned because while I was at Arizona State, I did research looking at individuals who were impacted by peripheral vascular disease and looking at different kind of treatment modalities using physical activity. And one of the modes that we looked at was a modified version of the Stairmaster, the stair climb of the stepper. And that resulted in Stairmaster approaching me with an opportunity to become part of their research and development team. And I did that for the middle third of my career. I was the senior VP of research and development for Stairmaster for about a decade or so. Oh. Then while I was at Stairmaster, I was asked to serve on a scientific advisory board for the American Council on Exercise. And that's led me to my current path, and that I really love the mission and purpose of the organization. And so I made that transition back in 2001.
Mm-hmm. Awesome. Talk a little bit about the American Council on Exercise, how long it's been around for and what it does.
Sure. It's a San Diego-based nonprofit organization that, its desire is to globally reach people, to increase their physical activity levels so it can have a positive impact on population health. And it was established in 1985. And our mission is a very simple one. It's to get people moving. But I think because of our name having exercise in it, people think of that as being exclusively focused on exercise or physical activity, when in fact, I like to think of it as to get people moving toward adopting and maintaining healthy lifestyles. Because really that's what's going to have that population health impact. And so there are really kind of 6 ways in which I think we kind of live out our mission. The first is that we certify exercise professionals and health coaches, and we have about 90,000 more health coaches and exercise professionals that are certified by us currently. We sponsor original research, and we tend to try to sponsor what I call more applied type research that, people who are working with individuals in the trenches can use and apply with their client population. We convene expert panels on physical activity and health. And I believe we're going to talk about one of those convenings, the Prescription for Activity Task Force. We work directly with community groups to try to help educate and empower and provide them with resources so they can deliver physical activity experiences that are safe and accessible to meet those who oftentimes can benefit from a lot of these interventions, but they have the least amount of access. We partner with like-minded organizations because we believe you can accomplish more working in partnership with others than you can trying to do it as a solo act. So we work with groups like the American Heart Association, the CDC, the WHO, others within our space, the American College of Sports Medicine. We really believe that we should be, rather than viewing things from a competitive standpoint, is really coming together and working together, because in all honesty, we share the same true competitor, and that's physical inactivity or unhealthy lifestyle behaviors. It's not each other. And then the last thing we do is we advocate for policies that help to make the active, healthier choice the easier choice. And we also advocate on behalf of professionals like yourselves to try to encourage your positioning on what I would consider the optimal healthcare team, where physical activity experts and exercise professionals and health coaches and nurses and doctors can work together as a cohesive team to provide the best care to individuals who need it.
Yeah, that's great. I think when a lot of people hear ACE, they do tend to think certification only, and it's very clear that that's a small part of your mission and how you're having that impact, which I'm glad we were able to kind of suss that out for the people that are listening. It's clear that based upon your explanation of your career, that you've seen a lot of different parts of our industry. And the industry has evolved tremendously in the 22 years I've been involved in it. It's even evolved more in the period of time that you've been involved. Talk a little bit about the evolution of the industry, because in my eyes, it seems to have gone through this process of, at one point we were kind of about bodybuilding, and then we were about weight loss, and then it was fitness, and now it seems to be more broader well-being or wellness. And in fact, that sounds like it aligns with a lot of what you're talking about that ACE is trying to do. Talk about how you view that evolution and maybe what's been the catalyst behind it.
Yeah, I think, Michael, I think you've really kind of captured it quite succinctly in terms of how it really has evolved from kind of the bodybuilding, the aesthetic kind of, exercising for the primary purpose of trying to look better and, kind of feeling better was kind of an innocent kind of byproduct, if you will. And then there's the, over obsession with regard to weight and weight loss and so forth. And what we're seeing now, I think, is as the individuals who kind of birth the fitness industry have gotten more mature, shall we say, I think there's been a greater appreciation for all the other benefits that we associate with being physically active, from the health medical benefits to the psychological benefits, and really this whole concept of exercise being medicine, I think has really what's kind of spurred I think that I think of it more of a maturation as much as evolution. I think that we're really starting to, move toward what really should be the highest purpose of really trying to encourage and empower people to be more active, is so that they can live healthier, better lifestyles, so that they can really, enjoy the highest quality of life that they can as an individual.
Yeah, and it's so interesting you mentioned your collaborative partnerships. I know I've seen a number of things that you guys have been involved with at ACE with regard to IRSA and the larger fitness industry. And you said it is very much a maturation and almost a legitimization of our industry on the public health spectrum. And I think that that's a very exciting place to be.
I agree with you. Yeah, no, it's really what causes me to really love my job, because I think we're really doing something that's really purposeful.
Yeah, and getting into that, I definitely want to dive into one of these initiatives, one of these expert panels. And this is something I came across just in doing some research independently. And when I saw this, I kind of was taken aback by the breadth and the depth of the task force in the document. And what I'm referring to is it's the Prescription for Activity Task Force. I believe you guys convened this at ACE in 2018. And talk a little bit about this. What was the driving force behind doing it? And what's some of the early results that we're seeing from this initiative as it gets going?
Sure. As I mentioned earlier, I truly and firmly believe in my heart that optimal healthcare is delivered by having a multiplicity of disciplines represented at the table and part of that optimal healthcare team. And one of the things that has probably been a personal and professional frustration of mine is that the fitness industry and the healthcare industries have been pretty disconnected. And to me, that we really need to come up with better ways to connect the two. And so one of the things that we decided was we kind of went on this journey of how could we, in a small way, figure out how we might be able to come up with a game plan for how we could connect the clinic to the community, if you will. And where we started was that, one, if you really want to have an impact and create that connection, everyone has to be at the table. It can't just be the fitness industry coming together and saying, this is how we want to connect with healthcare. And it just can't be healthcare saying, well, here's maybe some ways in which we might be able to let fitness in the door, if you will. And so we started to think about who should be all the important stakeholders that are going to be a part of this conversation. So we thought about, health medical professionals, fitness professionals, of course. We talked about payers, about insurers, all the different groups, that are important in terms of how we do healthcare, if you will, and how fitness can be a part of that conversation. We looked at things in terms of how typical people are prepared as it relates to healthcare. And what we did is we said, okay, how can we come up with this game plan in a really kind of comprehensive, but yet concise and kind of progressive manner? And so what we did is we decided to employ the theory of change approach to changing big systemic issues. And what the theory of change basically says, in short, is that you start with kind of your idealized ultimate outcome that you're looking for. And then you work your way back and you say, in order to achieve this ultimate outcome, what preconditions have to be in place, and in what sequential order should they be in place to get to that idealized outcome. And so that's what we did, is we convened all these great minds. We had people from the AMA, AHA, people from CDC, people from many of your significant fitness brands. We had people from the Academy of Nutrition and Dietetics, because that's an important element to all this. And so we had all the right people at the table. We had insurers and hospital organizations. And what we did is we came up with this game plan for how could we get to the point where we could actually start to have more individuals meeting the established guidelines for physical activity. Because one of the things we know from the research that grows each year and has grown for decades, that if we can get individuals to adopt and maintain active lifestyles, that it does a great job of helping to prevent and/or effectively manage most of the major chronic conditions that affect us as a population. So that's a way in which we could indirectly help to improve population health. And so the long and short of it, we went through about a 2-year period of time building this theory of change map that really outlines and calls for things to change within the healthcare system, things to change within education, things to change within, how things are paid for. And that's probably what you saw the kind of culmination of that 2-year effort.
Yeah, and it was a very comprehensive document, and I really enjoyed the theoretical framework that you applied to the initiative, because I think a lot of people in their overzealousness to get started sometimes don't think of putting that scaffolding in place first. And we're going to link up to that document in the show notes so everyone has a chance to look through it. I think it's a really as far as a policy-based document goes, I think it's a pretty engaging read. What have been some of the
kind?
Yeah. Well, it's maybe I'm a little bit of a nerd, but it's definitely worth skimming if you're not totally engaged by it. That's for sure. So tell me what you guys have seen so far in terms of maybe some of the early returns. I know COVID throws a big curveball in this entire mix, and certainly all of our healthcare providers have been focused on other things. But have you guys seen any momentum initially? What are you seeing?
I think there are a couple of things. One, I think by kind of displaying the fruits of truly being collaborative and kind of, taking your organizational hat out, off at the door. And so you can have these really kind of open and engaging conversations has served as a model for others in that there's a newly formed organization called the Physical Activity Alliance. It's really where 3 organizations that were really kind of working independently in the physical activity space have joined forces to really, I think, potentiate their effect. And so it's the National Society for Physical Activity, the National Physical Activity Plan, and the National Coalition for Promoting Physical Activity. They all join forces to become what is now the Physical Activity Alliance. And you have groups like the American Physical Therapy Association, you have representation from the American Heart Association, all working in this group. And it really is an extension of some of the things that we started with the PFA. And so that's really rewarding. And they're really focusing on starting with trying to affect some policy changes, because that can really serve as a catalyst for initiating some of those preconditions that we identified in the PFA map.
Yeah, it's funny you mentioned that. I literally just this morning was talking to Lori Weitzel at the AHA.
Oh, yes.
Yeah, and
Lori's a great friend. Yeah.
Yeah, and she says hi, by the way, and we were talking specifically about that, which I do want to touch on that really briefly, because I think a lot of people, certainly in the medical and the fitness industry, are kind of working on the front lines. We're at the grassroots level. Talk about the way that policy shapes environment and the way environment can shape behaviors.
Well, the thing is that if our policies aren't structured such that we're either incentivizing the right things or creating the right opportunities, it's very difficult for people to make those healthy choices and changes. And any behavioral psychologist will tell you is that changing behavior is, even behaviors that seem very simple, can be a monumental task. It's really a journey is what it is. And so anything we can do to help support that person along that journey is going to result in impact. And so that's why policy is so critical, because if you have, like, for example, if there's a policy in a community where you have, parks, and in order for people to, let's say someone like yourself who is competent, qualified, and trained to lead physical activity experiences, and you had a group of people who wanted to do a boot camp or something with you, you might not be able to do that in a local park, depending upon where you live, because of the way the permitting policies are constructed. And that would basically inhibit those individuals from having access to someone who is eminently qualified to help them on their journeys to be more active safely. And so those are the types of things. And there's so many examples like that where you have these policies that if you really are concerned about promoting and improving population health, you would probably approach them differently. And that's one of the reasons why we just launched a new initiative called Moving Together Outside, where we're trying to work with communities and local groups to kind of change some of the permitting so that there can be shared use of these facilities that aren't being used at certain times that can be great gathering places for providing affordable and accessible physical activity experiences for individuals, particularly when you consider what we're coming out of with regard to the coronavirus pandemic, where many of us have been isolated, shut in. It's a great way to get people outside, getting the benefits of being outside from a physical and emotional and mental health standpoint. It's just, to me, it's a no-brainer. But unfortunately, it's not the way things are constructed in many communities.
Yeah, and I'm so glad you mentioned that. I think one thing that as a fitness industry sometimes that we forget is that it's not just the four walls of the gym that constitute the environment to exercise. And I think COVID definitely brought that to light. But I'm so happy that you mentioned the national advocacy campaign for increasing physical activity outdoors, because that is literally something you guys just launched here in April 2021. Yes. Was that something that was in the works prior to the pandemic, or is that something that was more of an outgrowth of the pandemic?
Actually, that was in the works prior to the pandemic. It was one of our kind of key advocacy issues was to advocate for that, but the pandemic just really shined a light on it and made it even more of a priority.
Yeah, and I think it's important to point out when we talk about creating the environment that it's the parks, but it's also the other infrastructure. It's communities being walkable and rideable, yes, and things like curb cuts and well-lit sidewalks and all these things that traditionally you don't think of as facilitators of physical activity. But if they don't exist, people aren't going to get outdoors and do these things. And sometimes that's the only physical activity that they can afford. Not everyone can afford a $45 LA Fitness membership or even a $10 Planet Fitness membership in some cases.
No, and you raised a good point. It's so important to kind of, again, create that safe and accessible environment for folks regardless of your zip code. And so that's why I think it's exciting to me that more and more organizations and positions of influence and means are starting to recognize that and really kind of get on board with that notion of really trying to move the needle. There are kind of two great initiatives that I think is important for your listeners to become aware of. There's one by the CDC that's referred to as a Active People, Healthy Nation. And basically, again, because of the overwhelming data that demonstrates that being active can help one to be healthier and improve population health, their goal is to try to get 27 million Americans doing more physical activity than they currently do by 2027. And how they break it down is they'd like to see 15 million Americans who are currently doing little or no physical activity, your proverbial couch potato, if you will, to get up and do something. Because the one thing that we also are learning is that every little bit of movement counts. You don't have to go out and run for a half an hour for it to make a difference in your health profile. Then the second group they're focusing on is to get 10 million Americans who are currently doing something to try to meet the minimum guidelines of 150 minutes of activity accumulated over the course of the week, preferably done on most days if you can. Kind of think about 30 minutes a day for most days. And then the last group is focused on our youth, in that to try to get 2 million youth meeting the established guidelines for youth, which is about an hour of activity on most days. And so And how they look at it is much like what you described. They look at it by taking a systems approach, in that looking, at having, walkable communities, looking at having resources that are available, that are really can appeal to a diversity of audience in terms of economic status and so forth. Looking at really trying to remove all those systemic barriers that can result in making it more difficult for one to be physically active. And we know that being physically active is a tremendous challenge. And so if any little excuse many can find to not be active, because if we were to ask 10 people, do you think being physically active is important? I would say probably all 10 would probably say yes. But if we're asked that same 10, how many of you are physically active on a regular basis? Only about 2 would say yes.
Yeah.
And so what is it that's the disconnect between most people know and believe that being physically active is important and healthy, but only 20% do it on a regular basis? And so how do we bridge that gap? And a lot of it really is focused on kind of understanding behavior science and how we apply behavior change to that process and that journey, and really coming alongside folks and empowering them to make those changes and make the environment more conducive to them making those changes in a sustainable manner.
Yeah, it's how do we make physical activity the easy choice instead of the hard choice, which is what our modernized industrial society has done.
That's right.
You said something that I think it's important to not pass over, because I think it's probably the most important public health message out there with regard to physical activity in my mind, and I don't think it gets talked about enough. And I think back to Stephen Blair's research in the mid to late 80s about the improvement that you see in health status when you go from nothing to something. And I always call that the flattening of the curve before COVID got here. And maybe talk about that for a second. I think we hear the 150 minute per week guidelines for physical activity and people go, whoa, that's a lot. So 149 minutes bad, 150 minutes good, I think is what seeps into people's mind. Talk about that nothing to something change that occurs.
Well, there is a basic kind of physiological principle that's I like to refer to as kind of the law of initial value. And what that relates to is that the lower you are on the scale in terms of being, from totally inactive to highly fit, any little stimulus that I provide is going to elicit a pretty nice response if you're very low on the continuum. As we get up the continuum, that's when we need to think about, greater doses to continue to elicit improvements. But for that person who has not been doing anything, any little bit is going to cause a positive response by all the major physiological systems. And so, and the research proves this out over and over again. So much so that the American Diabetes Association, in its most recent recommendations, made the recommendation that any little exercise burst or snack can be very important in helping individuals to better control their blood sugar levels. They don't have to go for a workout. Just simply get up and move. April 6th was World Physical Activity Day, and their mantra is that all movement counts, and nothing could be true. And I think one of the things that we really can do a better job of is a better job with our messaging. To your point, in that, because many people look at it, well, if I can't do 150 minutes because they say that's the minimum threshold, why bother? Because anything below that, I'm missing the mark. I'm failing. And every little bit that you do, I use the analogy of money. It's like loose change in your pocket. It all adds up to real money at the end of the day. And you just keep accumulating that loose change until you get to a level where it's something that really makes a difference that's meaningful to you.
Absolutely. And so I think it would be safe to say that you will derive a greater health benefit from going from 0 minutes of activity to 15 minutes of activity per week than you will from going from 135 minutes to 150 minutes.
That is absolutely correct. Yes.
And that is the messaging that needs to get out there more. And I think the good news is we're starting to see that. You mentioned the American Diabetes Association, ACSM, their guidelines used to be the 30-minute threshold, and that's been relaxed over time. So I think we're learning how to really communicate to the non-traditional exerciser who's a little bit ambivalent about it.
Yeah, and really the true message is that some is better than none, and more is better than some. I mean, and it's really not that complicated, but and that's why we kind of simplified, because we had a long, wordy mission statement not too long ago, and we just sent, get people moving, because that's really, if we can just get people just to get up and start moving. And I always encourage people to not be so consumed and focused on the numbers, but to really just try to focus on how you feel as you start to make that transition from being inactive to doing something. Do you find yourself handling the stress that you encounter at work and in life a little bit better just because you're moving some? Do you see any changes in your sleep? Although, just look for those little small wins.
Yeah. And this goes back to something we talked about earlier, which is that we are moving away from the numbers on the scale and the way you look in the mirror to more of that one of the requisite benefits of activity and exercise, which is just you feel and you function better. And I think that that's messaging that needs to keep getting out there. So obviously we're here. It's still COVID-19, and COVID-19 strikes me as an interesting public health phenomenon, because this was one of the first times, at least that I think I can think of, where you actually had an acute medical event that would be made significantly worse by your level of fitness and by your level of body fatness. We've never had that. Most of the time it's very downstream. It's, you're overweight and sedentary now, you develop diabetes, then you develop, renal issues and so on. It's years down the line. This was very, very proximal. And so the question here is, do you feel that this will now allow there to be more momentum behind some of the initiatives that you and other players are putting forth, because this is so etched in people's minds, because it's just so real and visceral because of the pandemic?
I am certainly hopeful, Michael, that it will have a lasting impact. I think right now, people's attentions may be captured, and they start thinking about kind of leading healthier lifestyles, because we know that, as you described, individuals who are at the lower end of the fitness spectrum and at the higher end of the body fatness side of the continuum are going to be at a greater risk for contracting things like the coronavirus, having a much poorer outcome should they contracted. All those things we know to be true, and it's really consistent with things that I think that we've known all along. And so I'm hoping that once we're out of the crisis, that what we've learned sticks, and that we really work on. And the other challenging thing, though, is that many of the individuals who make up that group that's going to have those negative experiences, to your point earlier, oftentimes are not of the economic means or living in environments where they have ready access to what we've traditionally thought of when we think in terms of fitness and activity. And that's why I think we really have to change our thinking and approach and paradigm to really meet people where they are. And I just think of a wonderful example up in the Cal State Northridge area, where there's a program called 3 Wins. And we provide some monies to support their effort. What their great idea was, it's a university professor at Cal State Northridge kinesiology department had the wonderful idea that, my students, I give them all this great theoretical knowledge and training, but in order to really prepare them for what they're going to experience living a life like yours, is that they need to really be able to apply this and put it into practice. And so there was a park nearby that was basically in shambles, but it was in a neighborhood of Latinx primarily community, not of great means. And he thought, boy, what if we could go and start offering free classes for different levels? So they had like think of it a low, moderate, and high in the park for free to the people of that community. And so being a highly motivated guy, he got his students to go out and bang on doors and give pamphlets. And they got to the point where there were several hundred people that were coming to meet at this park to get a supervised physical activity experience by these kinesiology students to help them put into practice what they'd learned in the classroom. And that program has it's been phenomenal, the engagement. And lo and behold, guess what? The park now looks like the Taj Mahal.
Yeah.
Because the community members, they feel vested, they have a passion, and that's their park. That's their gym. That's where they go to work out. And so I think it's creative solutions like that where we're thinking about how can we work together to really come and meet these individuals where they are and provide them good quality experiences that they deserve.
Yeah, and that's such a great story because it shows you if you provide the access, if you create the right environmental conditions, and again, it could be that, it could be you put a healthy grocery store in a community, you put more curb cuts in places, that if you provide the access, and particularly when it's the community element, I think the thing that can't be lost there is that, those are pretty tight-knit communities, and there's something about getting a critical mass of people in a community, in a park, to do anything together. That social element is so key. Yeah, I think this is I am with you. I'm very hopeful that the burning platform that was created by COVID we can keep the momentum going. I guess succinctly, if you could, is what would you tell the people out there that are in the health sciences that they should be focusing on to keep this momentum going? I know that's a loaded question to be succinct, but is there a rallying cry?
I would say one is to really words and messages do matter, and I think we really need to kind of take some cues and some learnings from, I'd say, other areas and disciplines who I think do a far better job than we do in messaging and communicating what it is we have to offer. Because we need to, I think, better understand how to succinctly share the enormous, we have the magic bullet in a lot of respects, but we've got to be able to message what we have in a manner that connects with people's whys. And I think in order to do that, you have to engage with people and understand and listen and understand what their whys are. Because if you connect with someone's why, then you'll have the right motivational hook to get them in the game and to keep them in the game.
Absolutely. Are any organizations in particular that you think do a really good job at messaging that we could emulate?
Well, I tell you, I think Apple is an example.
Interesting. So
I'm quite excited actually that they are really kind of entering the fitness space in a big way.
Yeah, that's interesting. I think when you said that, my mind was going to, are you going to say the American Heart Association or the American Cancer Society? But what you're saying is that let's look at brands and business that really connect with their consumers. Apple,
Exactly.
or maybe like Harley Davidson or Southwest Airlines. So maybe this is part of the maturation of our industry that you talked about earlier, that we've been very insular and we've just kind of looked around at each other, but now maybe it's time to start looking a little bit more broadly. That's I think that's amazing advice. I think that's something we all need to open our eyes up to a little bit more. So you have a chance to interact with the entire ecosystem of medicine, health, wellness, fitness. You're connected nationally and internationally. As we close this up, what excites you? What excites you that you're seeing right now that people should know about?
I would say what excites me is that when you think about your leading public health organizations like CDC and WHO, what excites me is that those groups have really come to the firm realization that physical activity plays an important role in really improving population health and really should be part of I'll call it the healthcare ecosystem. And I think they've gotten to the point now where there's a belief that we don't need one more study to prove the value of being physically active. What we do need to do is figure out how do we close that gap, that disconnect that we talked about earlier, where 10 out of 10 would say it's important and I should be doing it, but only 2 out of 10 are actually doing it on a regular basis. What's going to be the solution for getting, say, 5 or 6 more of those 10 to start being part of that group that's doing it? And I think where a lot of the groups are landing is that it's really taking time to try to understand behavior change science and how we can smartly apply those learnings to help us better support those individuals who want to put into practice all these recommendations we make, but they just don't know how to do it. And we need to give them the tools and empower them with the resources to be able to make those changes.
Yeah, and you may have just stole the thunder from my last question with that great answer, because in my mind, the wellness paradox exists on no greater level than the 10 out of 10 people that say they should be active, but the 2 out of 10 that actually are. And it sounds like your contention, and I agree with this wholeheartedly, is that the way we close off that gap is by understanding more about psychology and human behavior change than necessarily understanding anything more about physiology.
Amen.
That's perfect.
Yes.
Cedric, this has been outstanding. Tell us a little bit more about where people can find out about you, the prescription for activity, ACE in general. Where are good places to go?
The easiest place is the ACE website, www.acefitness.org. All the things that we've chatted about and that you've mentioned can be found there.
Awesome. And I will link up to that in the show notes with some specific things. But Cedric, Bryant, thank you so much for joining us today. This conversation was a pleasure.
Michael, thank you. I mean, it was a pleasure. I could chat with you for quite some time. This was really quite enjoyable.
Likewise.
Well, I truly hope you enjoyed that conversation with Dr. Cedric Bryant. If you found the information useful and engaging, please share it with your friends and colleagues. It's through making that share and through communicating and collaborating that we can truly address the wellness paradox. Any information that Dr. Bryant or I wanted to share about this episode can be found on the show notes page by going to wellnessparadoxpod.com/episode 2. Please don't forget to subscribe to the Wellness Paradox on your favorite podcast platform and be on the lookout for next week's episode when it drops. Until I chat with you again, please be well.